Welcome to the show on AIDS and the World AIDS Day. And this year's theme, 2019, is Communities Make the Difference. And I'm joined by three lovely guests in studio. We have Doreen, we have Alice, and we have Kimutai. So as we mark this year's World AIDS Day, we're focusing on how communities can also be part of the solution. So when you talk about communities, who are we referring to in this case? Dr. Ari.
Yeah, when we talk about the community is the people. Yeah, basically community is the people. But again, we still have the stakeholders who actually come and, make up this World AIDS Day, starting with the healthcare workers. Yeah, the healthcare workers, when I talk about the healthcare workers, I'm talking about the counselors, the nurses, the doctors, and even we also have the teachers with us from the different schools. We also have the parents, whoever calls him or herself a parent. We also have the people from the government, like the MPs, MCS. Yeah. When they come together, at least they are able to unite and be able to fight against the HIV and AIDS. And not only fighting against HIV, there is also they also help in supporting people living with HIV, and also commemorating on people who have died on the same.
Mm-hmm. Yeah. So the whole aim of World AIDS Day is to, first of all, support those who are currently living with the HIV virus, and also to remember those who have died as a result of the virus.
Yes.
And let's talk about the health workers now. I think VCT falls under that. So maybe tell us more about the VCT centers, maybe what services do you offer there, and how accessible are they for patients?
Yeah. VCTs actually usually make a big impact, especially during the World AIDS Day. During this time, many visiting usually come out and they go to where they start the gathering, because I understand in every county there is always a gathering during the World AIDS Day. So that is the time the visitors go out there and offer free HIV testing. They also there is a possibility of also having a free medical camps, and they are able even to check on different diseases from different people. Also, there is by extension, there is also cancer screening. Yeah, cancer screening is also there. So that is the time you find that the counselors are out there to support and actually help people living with HIV and AIDS.
Yes. And you've mentioned families as part of the community we're talking about with regards to HIV and AIDS. So, Kimutai, what role would you say maybe your family has played in helping you even manage this condition and maybe even support you along your period?
Okay, first of all, I'll start by appreciating my family, because they have been very, very supportive since day one when I disclosed to them about my status. And actually, that one plays a key role in this life. Like, you have someone who understands you, someone who encourages you, someone who is always there for you. So family really plays a very key role. Also it happens at times, like maybe you are having some other issues, and HIV related. They'll always be there for you. They'll always be the first response. And in case you are also having some other issues, you approach them, and they will be they will really assist you. So they play a very key role.
Family is important.
Yes.
And for Doreen, maybe did family also help you along the way? You mentioned earlier that their first reaction wasn't as pleasant, but maybe moving forward over the 27 years, have your parents or your family played a role?
With my parents, yes, they've always been there, all the steps every day. The rest of the family members, they are there.
They are there. Okay, and in terms of the challenges that you have faced, maybe as patients or as people living with HIV, the virus, maybe in terms of accessing the drugs, the ARVs, they're supposed to be free, but
Yeah.
in some instances they are sold. So what challenges have you encountered on a personal level, Doreen?
As a person living with HIV, majorly when it comes to the health facilities and even access of medication, I don't think I have really ever faced any challenge on that one, because even during the post-election violence, we still had access to a medication amidst all that drama and everything. I know there were some people who in different areas were not able to, but for us it was, we just walked to a different facilities, told them our facility is located in the other side of town that is not, we cannot go there, so can you help us? And we were able to be given medication, and we moved on. In fact, that is something someone asked me, what if I forget my medication and I am far away, can I go to a different facility? And yes, you can, because as long as you have the card that shows that you take medication somewhere, then it means that you can be helped, which means that the medication are very readily available and they are free. I have had, yes, there are people who pay for them, but I don't know whether it's a choice, because ARVs are free. Even the container is listed not for sale, MOH. So if they're sold, I don't know. Maybe that is people's personal choices, and if people want to buy them, then it is good.
And Kimutai, have you ever faced any challenge when it comes to accessing the medication?
I think for the long that I've been on medication, I have not experienced any challenges. Like at times maybe I miss my medication because there's a shortage or something, but I've always been accessing my medication. They are readily available, and also like to appreciate the fact that we have well wishers, other private stakeholders who have also assisted in like bringing clinics closer to the people. It has really helped a lot, because initially, like I remember maybe in those early years, the only specific clinics where you can access those medication, but nowadays they are readily available to where we live in. Yeah, and they are also accessible for free.
Okay. And Daktari, we've talked about the VCT centers. So how can we make them accessible to literally everyone who is maybe living with the virus?
Yeah, well, thank you. VCT centers should be more friendly to every client who is accessing the services. Again, there should be a lot of networking. You network. You try to do as much as you can for the community to know the location of the visitors. And having said that, I also remember about the signposts. It is very important to have the signposts, because when I talk about the signposts, in most cases, the patients which we get here in KSCD, actually they come because of the signpost which is at the gate, and with the help of the government. So you find that with the signpost, actually, they make sure that if it's a VCT, we try and indicate that it's a free VCT, because some VCTs are the clients go there, the patient, they pay. They are not free. So it should be a free VCT services. Yeah.
Yeah. So you make them accessible at their scene, and they should be free.
That should be free.
Okay. And Kimutai mentioned the fact that we actually have organizations which are coming up to support the cause for those living with HIV and AIDS and making the medication available. So what role do you think maybe the government should play with the same regard?
Yeah, they should be. The government should make sure that We have plenty of medication, you know. The medications are not scarce, especially when now the patients comes to seek the help, or maybe to collect their medication. There are all types of medications. The medication should be available for the patients. And one thing I would like to say is that when Doreen talked about the post-election violence. Yeah, the one important thing is that even for the patients to come to learn the names of their medication, it is very important. Because even if you have that card, it will be hard for the doctor to prescribe medication for you, not unless now you know the names of the medication you are taking.
So knowledge is important. Know what drugs you need to take. And in terms of the NGOs that we have now supporting those people who are living with HIV, then what challenges do they face? Such NGOs, or maybe even the health workers or community workers, what challenge do they face maybe?
Yeah, you know, most of the NGOs deal with the donor funding. Yeah, and anytime the donor can pull out. So you find that the moment when the a certain donor pulls out, there is always a gap. Yeah, so that is the major challenge, you know, NGOs are facing, because at that point they are unable even to get the proper medication for their patients. And you find that at the end of the day they continue like referring their patients. And I want to imagine if this patient is being referred like one or twice, and this patient goes to the other point, and the patients find that other point has good services. Of course, this patient will tend to take a referral letter to that. So you find at the end of the day, the NGOs might end up losing patients.
Yes. And in light of all the challenges that we have mentioned, what do you think is the best way going forward to maybe facilitate a better response towards AIDS and also be part of the solution, Doreen?
The first, what is it called? Like they had first said, HIV, we should end HIV by 2020. 2020 is in how many days again?
1 month.
So, and if you look at that, you realize it was not achievable. Why was it not achievable? Because we have free medication, we have VCTs going on, we have come the way of now prevention, we have introduced the PrEP and the PEP. We have now gone even to testing ourselves, which is now the self-test kit. But we have even come to the point of undetectable, where we are telling now people, if your HIV virus is undetectable, you cannot transmit it to your partner. But with all this, why is still there new infections? Why are prevalence rates still coming up? It means that there is something, that there is a gap that we're missing. And that gap is the stigma. That stigma that has prevented people from talking about the HIV status, the stigma that has prevented partners from knowing each other's HIV status before getting married, the stigma that has prevented most married couples, because now we saw that the latest statistics show that people in marriages are even having a higher prevalence rate than people who are single. So why is that going on? Why are men waiting for their wives to become pregnant then go get tested? It is because of that fear. And the fear is basically what we call the stigma. So we need to put more voices, more lived experiences, more practicality to fighting HIV. Telling people, yes, you need to know your HIV status. Yes, you have come to a VCT. But before you have come to a VCT, what do you know about HIV? You know, what information do you have? So that even as a healthcare provider talks to this person, they know that I am approaching this person from this angle. This is a person who is who has taken the myths and misconceptions and run with them. So let me try by ending those myths and misconceptions first. You don't always have to test this person. You can always just bond with that person, talk to that person, so that if you reach one person, you have reached like 10 people, because personally I use social media for my advocacy, and sometimes I tell people things and they're like, no, we thought people with the blood group don't get HIV, and I tell them no, that is all a myth, it's a misconception. So until we keep the conversation going, I always say, as people living with HIV, our lives don't only matter on World AIDS Day. Yes. Because we are living with HIV. My World AIDS Day has been every day for the past 27 years. And so we need to keep that fuel that every day I am living in this condition. But it's not making me worse. It's just I'm getting better. I'm becoming a better person. You also can become a better person. Then that way we will end AIDS by 2030, which is the new target. But until, if we keep on doing the same thing, wait for World AIDS Day, accelerate the message, input nice advertisements and everything, and then we have to wait for another World AIDS Day, then 2030 will come and we will still be talking about the same exact things. We will still be talking about the new infections. We will still be talking about people who are still afraid of getting into VCTs to know their HIV status.
Okay, we need to have the conversation every day because it is an everyday issue, not a one event in an year.
Yeah.
Okay, Kimutai, do you think there is anything that should be done going forward to facilitate a better response towards AIDS?
Of course, there are a lot of things that should be done. On one, I think also this thing should be incorporated in, there should be initiatives at institutional level, at personal level, like you identify a role and you play that role in actually in making these people understand about more about HIV, accepting themselves, going for tests and all that. So that is as an individual. And then also as an institution, as institution, be it learning institution, be it a business institution, I think they should also establish things like a day like an holiday, whereby the workers of that of that institution will not report to work or bring visitors into that institution, and they be allowed they're allowed like an off or something, then they can access the services. And also it would be in our learning institution, especially from the high school level, students should be exposed into these things, so that even as they clear school, they know that as they go and start life out there, they should start from that, from knowing their statuses, and then from there now, and they can plan their lives well.
Okay, know your status, then get the relevant information that you need.
Yeah, and then now you start planning your life from there.
And Alice, do you think maybe at the policy implementation level, do you think there's something that needs to be done to facilitate a better response towards AIDS?
I think the far we are, I think we are doing well. But something can still be done. Like we can still be having a lot of mobile visitors. Yeah, mobile visitors in order to reach that somebody in the rural area, or maybe from the slums. Because you find that when we talk about stigma and we talk about fear, you find this fear is all about fear of the unknown. You know, they fear what they don't know. But the moment you reach them there and they see one of their colleagues is getting tested, of course the majority will go for testing. But telling them to walk to the VCT, again, it has become a very big issue. Yeah.
So mobile visitors.
Mobile visitors, yeah.
Okay.
Can I do something? You find in most hospital setups, HIV services have been disintegrated. Like the CCC, is at a different place. So you go to a hospital, you ask, where is the CCC? They direct you to a very secluded area, or like a different whole building on its own. So I think if we integrated the HIV services with other health services at the hospital level, that stigma will come to an end. Because
Yes.
if a malaria patient and a cold patient are both in the same queue going to see the doctor, why can't a HIV patient be in the same queue? Because at the end of the day, if you're not being defined by our HIV status,
Yes.
then it also shows that the HIV services should be integrated into all the other health services, so that when you walk into a hospital, you feel like a normal person. Not that you're walking through the gate and then you're
You're
asking
referred
yourself,
to a
who is
different
seeing me
place.
going to that CCC, so that you can walk quickly so that nobody can see you entering that building.
So
Yeah.
integrate all those facilities in one
In
area.
one, yeah, exactly.
Okay. And as we wind up, what does the World AIDS Day mean to you, Doreen?
As a person living with HIV, World AIDS Day means that it is one more year of celebrating the steps we have made, especially as a country, and also celebrating the people who have lived with HIV, who we have lost, and also making new commitments that we as a country, as a people, and thank God that this year it's now the community that is going to make the commitments,
Yes.
that going forward we want to see an AIDS-free Kenya. We want to see a stigma-free society. We want to see a place where people living with HIV are also made to feel like they're also people. Because before the virus, there is the person.
Yes.
So we are looking at the person and not the virus. Si ule mtu wa HIV ni ule mtu.
Yes.
Yeah.
Willem say.
Ule mtu.
Kimutai, what does the World AIDS Day mean to you?
Okay, on one, it means that irrespective of my status, I'm appreciated and embraced in the society. That is one. Also, number two, this is a day, or rather, yeah, it is a day whereby you get to like interact with new people. You get to learn of new of the progress that have been achieved in the HIV field, and you also you get to be exposed to what was happening earlier, what is happening now, and what is expected in the near future. So it's like it's a day whereby it allows you to access like all those information of the past, the present, and the future, and also like interacting with different people. You get to learn new things. Yeah.
And we'll be having an event on the 1st of December, right?
Mm.
To commemorate the same.
Yeah.
So what event is happening where, Doreen?
I sit in the MIPA working group, which is the Meaningful Engagement of People Living with HIV. It's a working group under the National AIDS Control Council. And MIPA has basically come up with a way that every year we celebrate World AIDS Day in different counties. We used to have it being celebrated here. People will come, give speeches, and talk about themselves. We will celebrate and go home. But now this year they have, last year it was in Bomet County. So this year it's going to be in Kisii County, and I am so proud because I am from Kisii County. So this year it's going to be in Kisii County, and different stakeholders, different people of the community, faith-based organizations, they're all going to gather there and basically give their commitments as a community of people living with HIV from different constituencies, that this is going to be our way forward and this is what we are doing. There are going to be lots of awareness creation activities, especially on the HIV tribunal, because you know, as much as we are fighting HIV, we are ending stigma. There are also issues like human rights issues, people being discriminated at their places of work, even disclosure. People they're forced to, it's called coerced disclosure. So how do you go about it? And actually the HIV tribunal has promised to be in different counties with stands, so I'm really hoping this is going to happen. They're going to be in different counties. They will be sending representatives so that they can give people their information, that this is your right as a person living with HIV. This is where you go. This is what you do just in case of this and this scenario. So there's going to be that, and then there's also going to be the different medical camps, and so there are going to be lots of activities. I cannot really say all of them,
Yes.
because yeah, it's a process, but then that is basically it. That is the event that is going to be happening, and yeah.
Okay. So what role will you play yourself?
Personally, I will not be in the country. I will be at a different conference called
Yes.
the International Conference for AIDS and STIs in Africa. It's happening in Kigali from 1st to 7th of December. And so that is where I will be. But still my voice will be somewhere in Africa making other policies.
Yes. Kimutai, are you attending the event in Kisii County or your home county?
Oh, okay, it's still it's still early. It's still early for me. I'll see whether I'll go there. But also apart from that, and a national event, we also have other events, maybe at the clinics level, and also we have at the county levels. So I think I'll just have to go to one that is maybe near me.
Okay, sawa. So thank you so much for making time for us and for having such a very interesting discussion and just raising awareness about what AIDS is and how we can also be part of the solution and help people who are going through the same. So thank you so much, Doreen.
Thank you.
Daktari, asante sana. And thank you so much, Kimutai, for making time for us today. So we were talking about AIDS and the World AIDS Day, and the 2019 theme is Communities Make the Difference. So I urge you, in whatever capacity you are in, please just try in however small or big way and be part of the solution as a family member, as a work colleague, as a a community worker, or even a peer educator. Please try in whatever capacity you have to make a difference, as small or as big as you are, because you are one community and we are one country, one nation. So thank you so much.